Hi, I'm Jennifer Smith.
And I'm Melva Jones.
And we are Women's Health in Black and White. Today we're going to be talking about something near and dear to Melva's heart. I'm going to go over fibroids. And she claimed to have a fibroid for about 9 months.
I was just about to say, I know people are like, why are you excited about a fibroid? But I had convinced myself that I had a fibroid instead of a baby.
Despite the fact that it had a heartbeat.
Right, and Jennifer killed my joy by showing me that it had a heartbeat and turning the sound up even louder so that I could hear the heartbeat. But I was perfectly happy with my baby being a fibroid, and I love her to death.
She's
now,
a beautiful little fibroid. She's so cute.
For 9 months, I called it a fibroid.
She did. It was great.
This is a legit story.
People would ask if she'd picked a name, and she would say, "You mean for the fibroid?"
No.
I'm probably not going to name the fibroid.
We're just going to get rid of, we're going to cut that out at some point. But she was born healthy, and it's been great.
Yep. It was all good in the end.
All good in the end.
So, fibroids are non-cancerous tumors. Mm-hmm. And I want to say that again slowly because people hear the word tumor and wig out.
Yeah.
They are non-cancerous tumors.
Right.
They're just growths that happen on the uterus or in the uterus.
Yeah.
They're also called myelomas. So if you have one removed, you're having a myelomectomy. That's how that's called. We've had patients tell us that they had not uterine fibroids, but fireballs of the Eucharist. But they are non-cancerous. They do grow, and they happen pretty frequently in childbearing women. There's about 200,000 new cases of fibroids every year. How do you know if you have a fibroid? Well, unlike Melva's, which moved.
Right.
Many women don't.
Yeah.
Very frequently, we go in because we have to do a C-section on a patient, and we find out that she has fibroids that we couldn't even see on ultrasound.
Yeah.
If you do have an ultrasound, you might pick them up. Never had a symptom, but my goodness, look, there's a fibroid. But some women do have symptoms. Those symptoms are usually heavy bleeding, long, quite painful periods, but very frequently, there are no symptoms. Mm-hmm. So, treatment for fibroids. There's a bunch. If you don't have symptoms, one of the big treatments is watch and wait.
Yeah.
If you're not hurting, your periods aren't bad, and if you're not looking to be fertile, then we really don't worry too much about a fibroid. It's not going to cause any problems. If you're looking to get pregnant, though, we do sort of want to know where those fibroids are because they can cause some pregnancy complications. But very frequently, if you're not having symptoms, we just catch it on an ultrasound we were doing for something else, you don't have to have any treatment at all. There are medical devices that can help shrink a fibroid. They're called intrauterine devices. They're IUDs, and they're for birth control. But they have in them progesterone, so they produce this illusion that your body is pregnant, and sometimes the progesterone can shrink the fibroid. Birth control pills do the same thing. You can do a sex hormone suppression medication like Lupron, which will do the same thing, shrink the fibroid. There's surgery, myomectomy, or hysterectomy. Hysterectomy, of course, you're done having babies.
Right.
That's the end of your fertility.
That's like last option.
That's the end. And if you're done having babies and your periods are really terrible, you may want to just go ahead and take that option.
Right.
A myomectomy doesn't necessarily mean the end of your fertility, but depending on where the surgery was done, how extensively the fibroid extended into the uterine wall, it may dictate your delivery method. You may not be able to have a vaginal delivery. You may have to have a C-section, and that's something you would want to discuss with your surgeon prior to your surgery.
Right.
There are other medical procedures that may work. There's an ablation to the uterine artery that's feeding that fibroid. In other words, they just kill that one little artery that's feeding that fibroid, and the fibroid dies. So that's a possibility. There's something called myelosis. That's using electrical stimulation or radio frequency to break up that fibroid and prevent it growing any further. About 2/3 of women who have fibroids will notice that they grow during pregnancy. The biggest problem, other than the fact that they may interfere with uterine contractions at delivery, sometimes those women just don't contract effectively, they just don't make it to 10 centimeters and able to push. But the other big problem is because they are growing on the uterus, it makes it very difficult for us to reassure ourselves about fetal growth. We can't lay our measuring tape on your tummy and say, oh, good, you're 24 centimeters and you're 24 weeks, because very likely you're going to measure quite big.
Yeah.
So you're probably going to get more frequent ultrasounds for growth. Only about 10 to 30% of women who have fibroids will have complications during their pregnancy, but the complications that you may experience are growth restriction. That fibroid in the uterine wall can press upon the baby. It limits the space the baby has to grow. Placental abruption is a big one. Very rare, but it happens.
Right.
So if the fibroid happens to be behind where the placenta has implanted, the placenta can tear away from the uterine wall. That's a medical emergency for mama and baby. You would know that was happening. Heaven forbid it happens, but you would know because you would bleed and you would get a rigid, very painful abdomen. Preterm labor is a definite possibility.
Yes.
While I did say that sometimes the uterus doesn't contract well with the fibroid there, unfortunately, sometimes it contracts too well too soon. So you may notice increased Braxton Hicks contractions, and they can morph into preterm labor if you aren't paying good attention. Anytime you have more than 4 contractions in an hour, if you're headed into hour number 2 saying, oh my gosh, this is getting worse, you should call us. C-section is definitely a possibility. It tends to slow down labor. And if you've had surgery on your uterus, that might dictate a C-section too. But the other thing that the fibroid can do is prevent the baby from turning into the head down position. So a breech baby would also necessitate a C-section. Also, there's a slight chance that a really big fibroid can cause a miscarriage. It doesn't happen often. If you've had a miscarriage recently, don't go in demanding an ultrasound for fibroids. It's really rare. But it is a possibility. About 79% of them will shrink after you deliver. And about 1% of them will turn out to be really cute 3-year-olds.
Now, I do have a friend who won't call a name, but she did have a question about fibroids, and just so we can dispel this myth a little bit. But her question was, I'm afraid, she's like, can a fibroid, will that like pop the amniotic sac? And I was like, not necessarily like in those terms. Like, she was thinking like if the baby brushes up against the fibroid, could it like harm the baby? And I was like, no, not like that. Like, it can cause, like Jennifer said, a miscarriage or preterm labor, but it's not like it's this rigid structure that if the baby like is gonna damage the baby that's in there. But it was funny to me, but I was like, okay, this is a legit question, I guess, if you don't understand that. So just wanted to bring that up.
I have had a lot of patients with fibroids go through pregnancies just fine, but experience a lot more discomfort.
Right, yes.
It seems like those babies love the little fibroid and
they
like
keep messing
cuddle up to it or kick it or punch it. I don't know what they're doing in there.
I haven't noticed that.
Yeah.
Women with fibroids, they do complain of pain during pregnancy more than women who don't have them. So that is a legit concern.
I did have a patient one time. I'm obviously not going to mention name or demographics, but it was a long time ago. She had been scheduled for a hysterectomy because she had a really, really big fibroid. And the morning of her surgery, they did a pregnancy test, just in case. Gosh darn it, sure enough, she was pregnant.
Oh my gosh.
And she had a pretty decent pregnancy for how big that fibroid is.
Yeah.
The day that she walked into my office for her new OB, she was only 6 weeks pregnant. She looked more like 28.
Oh, wow.
And she was a slender girl.
Yeah.
She was very slender. She looked hugely pregnant. She made it to 32, 33 weeks, something like that, before she went into preterm labor.
Yeah.
Which we thought was fantastic.
Yeah,
We'd been waiting for forever for something really bad to happen. Had a healthy baby, and then had a hysterectomy.
Awesome. That was going to be my next question.
Yeah, she sure did. She sure did. She scheduled that hysterectomy for as soon as she could. But yes, fibroids are non-cancerous. I'm not going to tell you they never cause problems.
Right.
But if you have them, don't panic. It doesn't mean you can't have a healthy baby.
Right. Correct.
Stay tuned. We've got good stuff coming up. We're going to talk about ovarian cysts in a future episode. We're going to talk about sexual aid devices. We're going to talk about second trimester. We've got to pay that off. We're going to do all 3 trimesters. We're going to talk about that. Talk about vaginal bleeding in pregnancy, when it's alarming, when maybe you can brush it off a little bit. Go and check us out on Facebook,
Instagram, Twitter. Our podcast on Spotify.
Yep.
Afterglow.
Yep.
And we will see you guys later.
Bye.